So how do you create a brand? Again, some fonts have got misplaced, but by introducing systems, organization, standardization, bringing relevance to what you do, bringing clarity, bringing simplicity, and most importantly, ethics. Yeah. Most of the brands that you're aware about have been created with these systems. Yeah. And if you see here, I have not even written marketing here. You see marketing here? No. You'll be surprised. Some of the most iconic brands have the least marketing budgets. What we call as word of mouth marketing actually is the brand speaking for itself. So, my question again is the Indian healthcare industry really branded when 80% of the industry has not even understood the importance of the subject? The answer is not tough to sort. This is the most typical situation. You don't always end up being in a Max or a Fortis, or a top hospital where everything is fairly structured. This is the real scenario. You have queues, you have quacks, and you have chaos. So this is our philosophy. As a branding organization, we say that branding is the opposite of chaos. Now there's another interesting philosophy to go with it. If branding means that it has to be perfect, let's say 100 out of 100 times consistent experience, because ideally there should be no perfect brand. It's not possible to get there. Yeah, perfection is something which nobody can achieve. So if we say that the average discharge time for a patient should be 30 minutes, it might not happen always. There might be a situation where you can't ensure it. Yeah. So we can often say that if we can gradually and systematically eliminate chaos in the way we operate in our systems, in our organizations, we're gradually getting branded. And therefore, there's another interesting word that comes out of this, which you will not find in a dictionary, is called anti-chaos. Now, anti-chaos is just before the branding state. So you're anti-chaos in your mindset. You don't like chaos. You like systems. You like organization. You want everything perfect. Yeah. You can't compromise on outcomes. You can't compromise on customer experiences. Things that we spoke about in our previous sessions. So that's how you start to become a brand. What is chaos? Mismanagement, inconsistency, inefficiencies, failures to perform, being outdated, being unprofessional, out of control, not very good looking. These are all examples of how chaos gets created. And what is branding? When you become more relevant, you become more contemporary, you're correct, you have to be correct. Yeah. You're complete, you're aesthetic, you're simple, you're consistent, and finally you're simple. Yeah. There have been several case studies which have proven that a strong brand requires less money to market it and saves tons of money managing the chaos. Yeah. So, coming to the topic at hand, can branding play a role in transforming Indian healthcare? Now I'm taking the question the other way around. So we've tried to prove, I hope most of you agree, that the Indian healthcare industry is not branded. Yeah. But can we try and transform it? But using branding as a tool? So there could be two ways to it. You could be very organized and you want to brand yourself or tell the world that, look, this is how I am. Maybe your positioning doesn't come out very clearly, but your systems are perfect. But I'm saying, let's do the other way around. Can branding motivate a transformation in the Indian healthcare sector? Yes. Branding can be the driver of change. We've experienced that in several rebranding assignments we've done. We worked with highly chaotic companies, creating chaotic products, and using the brand promises they've had a driver to change for managing the chaos in the Indian healthcare space. So what is necessary for transforming India into an attractive healthcare or life sciences brand? So if we were to really start at the gist of everything, if I were to get into a position where I said that, what if I told you those 5 things which were essential in creating any healthcare brand? So you could be running an educational institution, you could be running a hospital, a small clinic, creating OTC products, creating prescription products, running a portal, running a consulting company like mine. So again, you're creating a healthcare brand. Yeah. So what is really necessary? So 5 things that you can note. But before that, you have to brand every single component of the healthcare ecosystem that we discussed one by one. Yeah. So it's a massive exercise. We've already created so much chaos. So if we don't wake up even now, we'll keep on creating more chaos. Yeah. There are more than 1 million different touch points working just in a hospital every day. When I say brand touch points, it essentially means that wherever your brand touches the consumer or any other stakeholder. So how can there be 1 million? Website is just one of the touch points. Brochure is a touch point. These are the touch points we are familiar with. But the people in a mid-sized hospital, let's say there are about 250 people, who do more than 1,000 interactions with their peers, with the patients, with nurses, and everybody who comes and goes. You just have to keep multiplying. And every experience becomes a touch point, which needs to be managed. Now, you cannot do it by asking each person to change. There has to be something more fundamental. The branding process has to start first. You have to change it from the root. Otherwise, your tree is not going to be strong. If people believe in the value system that you create, you're going to experience that they try to follow you. Yeah. And the peer pressure starts to work. And which is why I said, branding is the driver of change. Many of us Indians sitting here might create chaos when we want to, but the moment we travel to a more branded location, let's say in Europe, we become mannered. Yeah? So peer pressure works. You don't want to be highlighted. Right? So therefore, it's got to start from the root. So 5 A's. The 5 qualities of an attractive and desired healthcare or life sciences brand in India. Number 1 is ability. The brand has to perform. And if you go with the real definition of branding, you can actually separate the product from the brand completely. You don't need to become a brand because of the product. The product can become because of the brand. But it's still got to perform. So if you promise something and then you don't deliver, it's not going to work. Yeah. The second is affordability. Affordability does not mean cheap. As the economic wealth of this country grows, the affordability also grows. Yeah. I think which is one of the big things that all pharma companies or all medical device companies in India are today looking at. They're looking at a growth of about 15 to 20% year on year, purely based on the fact that India will become richer and richer, and branded products or the slightly more premium products will be more acceptable. Yeah. So we don't always have to go cheap. Of course, the price controls is something which kills the market, which can actually slow down how the industry grows. The third, and in fact, in about 6 to 7 years' time from now, as per a McKinsey report, accessibility will have far more priority compared to affordability. Yeah. So a lot of people are going to have money, but if the healthcare or the product or the service is not accessible to them, what a waste. you're not able to reach out to the customer. So accessibility is a very, very integral part of how you're going to create your brand. Acceptability. The world around you has to accept the brand that you create. Yeah. And acceptance going forward will also depend on factors like how ethical you are as a brand. So things are changing, you know. There might be a general feeling that, you know, we are becoming more and more unethical, but the more people I meet, they want to change. Companies who've been unethical want to be ethical today. So there is a shift which is happening because there is more transparency, which takes me to the last point, the accountability part. So I'm forced to be ethical in a way. Yeah, everything gets onto the internet fairly quickly. You make a mistake, you try to be over smart, you're on the news. It's happened so many times with so many companies in healthcare, right? So the accountability part is going to be equally critical when you're trying to create a strong healthcare brand. First as a component of the entire ecosystem, then component by component. So if there are, 100,000 products just in the pharmaceutical space, not everyone can reach the status of a brand. We like to call them brands just because they have names. They need not necessarily be brands if you go by the definitions that we're talking here. Yeah. And again, if you see, I'm not talking about popularity. I'm just talking plain simple stuff. The creation bit. Let's just create it perfect. If we can then use the right marketing tools, then people are going to come to your house. So it's like we first get the house in order, and then we can invite people. Yeah. And then they're going to stick around, and they love your place, and they want to spend more time with you, which sometimes we call as customer engagement. Yeah. But if they don't like your house, chances are they're never going to turn back again. Great. So getting closer to my conclusion, branding is all about making the right choices at every stage. Many of you are from the top management here. You have to take decisions almost on the fly. Sometimes 15 to 20 decisions every day, small or big, but you keep taking decisions. You can compromise, of course, that's one of the options. You can do the Jugaad, that is another option. I think we are faced with it, all of us are faced with it, day in, day out. I'm faced with it myself. I can also do a Jugaad and do a pretty good looking branding exercise in terms of visuals, but if the strategy is not strong, I know that it's going to backfire and it's not going to keep me sustaining for long. Yeah. So we are making choices all the time, multiple choices. And therefore, you must make an impact with every brand touch point. The big challenge between the services and the product part is the services business of the healthcare usually has thousands of touch points which are at work because it involves human experience. And human beings, unfortunately, are the most inconsistent of all creatures. So today I'm happy, tomorrow I could be unhappy. Yeah. But yeah, of course, we try to automate things and we have a robot doing a procedure, a surgery, chances of error reduce. Or if we have a product, let's say an RX product or an OTC product, because it is manufactured using the same inputs every time, the same process every time, and the output is likely to be the same, the packaging material remains the same, you can expect a more consistent experience over time. Yeah. So creating a product brand, and I'm not taking away any credit from people who've created great product brands, is actually comparatively easier than creating a services brand. But then we are here talking about the entire ecosystem. Yeah. Getting the healthcare industry branded, becoming more desirable for the entire world, as a point of healthcare, which we're trying to do using words like medical tourism. But again, tourism is inviting people to the house. Who's going to get the house in order? Who is going to take care of the fact that there should be no chaos? There should be no middlemen. So finally, coming to my last two slides.
We'll have last 2 minutes to wrap up. It's
I'll take
extended.
one.
Yeah, thanks so much.
Chaos, like we all know, is equal to higher cost. And branding, like we tried to explain, is equal to lower cost. I'm not talking about the marketing part here. Higher cost is not equal to lower cost. And trying to simplify things, branding is not equal to chaos. So therefore, that's something that we have to all work upon. So I'd like to thank each one of you, and for the 1 minute that I'm left with, I'd be happy taking a few questions. Yeah.
Any questions? Yeah, right here.
Yeah.
Branding exercises of the services aspect of healthcare,
Yes.
but just want to understand from you, during your experience, how many of the hospital providers have actually been honest in sharing some of their performance metrics? And here I don't talk in terms of the numbers of procedures done or something of like the volume. I'm talking about the delays, the waiting times, the infection rates, etc. Because that's one concern area where we still don't have benchmark figures for India scenario.
Right. It's an excellent question, actually. What we've experienced when we've spoken to a lot of healthcare providers, and primarily hospitals in this case, and I'm not going to mention the case study which is actually mentioned in the brochure to keep things simple. Some hospitals that we're currently working with. Doctor, you're actually right. You know, hospitals want to hide, but the challenge that they're facing today is survivability. Yeah. Some of the hospitals we are talking to were iconic about 20, 25 years back. Today, they don't have a positioning. Yeah. They don't have any experience to talk about. Forget satisfied customers, forget experience, you know. They are completely inconsistent in the way they deliver. So at one point they say we are ortho specialist, at another point they say we are an oncology team, you know. Then they want to become a cardio team overnight. But you're right, they're not even focusing on the non-clinical aspect of the business at all. And because they want to change, I'll be glad to tell you they're willing to be honest, because otherwise they would not even survive. So it's a survival issue now for a lot of hospitals. Now, competitive pressure of this kind is also forcing a lot of service providers to rebrand themselves, to reposition themselves, trying to change systems, sometimes changing the entire infrastructure. But you know what? All these hard assets can be changed. But the most important challenge we face in any branding exercise is the soft asset, which is the mindset of people. Yeah. Even if you lay down guidelines and put down standards, you've got to make people to follow them. So there has to be a dedicated, a holistic training process to cause this change. And sometimes it means firing people who don't follow the systems. Yeah.
Thank you.
Yeah. Thank you.
Thank you, sir. Thank you so much. Any more questions can be taken over lunch. I hope you're staying for lunch. Yes, thank you.